I think right now the biggest challenges are not that different from the challenges to really expanding the deployment of self-driving autonomous vehicles. The technology is getting pretty advanced, but the liability and accountability issues are a major challenge. You know, if you're driving on a city street and somebody jumps out in front of your car unexpectedly, and you either can hit that person or swerve and potentially hit someone else, we don't really hold you accountable for the decision that you made of whether you swerved or not. But if an autonomous vehicle is driving, there's a predetermined software decision about what to do in that setting. And it's really not clear who's responsible if the autonomous driving software ends up causing damage. It's not clear who's on the hook for clinical decision making. Right now, it's the physician. And that's fine as long as the AI is presenting suggestions that are readily verifiable by the physician expert themselves. Hey, Lee, it could be A, B, or C, and I then decide between those which is most likely. But as these tools get more and more sophisticated and they can see things that we can't. So in digital pathology, digital radiology, the algorithms can detect things that human eyes can't appreciate or human brains can't appreciate. Who's informing who there? Who's whispering in whose ear? Because I have no method by which to determine if the algorithm is correct or not. So I think that's one really enormous thing. I think the second is trust. I think the public trust is still being defined, whether or not a doctor who uses AI is a better doctor than a doctor who doesn't, or a worse doctor. Is it a crutch, or is it a sophisticated, advanced tool? I think there's lots of concerns about privacy and how the data will be used that we really haven't settled. And then the last thing is, I like to say it's the head of the dinosaur and there's the tail of the dinosaur. And the tail of the dinosaur can be quite long. So the cost of licensing one of these algorithms is relatively predictable. What is not predictable is what is the cost of owning and operating it, because you can't just set it and forget it. You have to continuously monitor its performance because many of these algorithms are continuously learning and evolving and fine-tuning themselves to your population of patients, which means the result you get on Chris today, if you went back and ran the same model 6 months later on original Chris, you might get a different answer because the model is changing over time. So in some ways, it means like I have to continuously evaluate the performance. It would be like an employee who has to be monitored the way you would monitor them for the first 6 months of their job. You'd have to monitor them every 6 months. So that's a big and underappreciated burden. And most health systems at the moment are taking a position of this has to be risk-based. The greater the risk, the more frequently I monitor. The lower the risk, the less frequently I monitor, because we don't have the infrastructure or the resources to monitor everything intensively.